As the weather gets colder, you are probably making more plans through the end of the year, which means also it's the time to prepare for possible spikes in flu and COVID, as well as just cold season in general. WLWT News 5's Meredith Stutz live from Christ Hospital with a look at how vaccine turnout is going so far. Also, what you need to be aware of as you get those vaccines. Meredith.
Hey, good morning to you, Kelly. Yes, so according to the Ohio Department of Health, we do know that 65% of Ohioans have received at least one dose of that COVID vaccine. And according to the CDC, we're actually up when it comes to flu vaccines. About 130 million people have gotten that flu vaccine so far this year. Now, that includes, that's actually, as I said, up from this time last year. Now, Christ Hospital, where we are this morning, says overall updated COVID vaccines, though, are down. Dr. Thomas Amar, who is the medical director of infectious diseases, says the overall dip in COVID vaccines can be traced to vaccine fatigue. Right now, we aren't seeing a large number of flu cases locally. It's still early in the season, but they are ramping up in the south. On the flip side, we're seeing a downturn of COVID cases after a recent spike. Still, Dr. Amar says it's important to be able to get both vaccines if you are able. He addressed the reality that some people can experience some pretty miserable side effects from the COVID vaccine, which can deter some from getting the vaccine altogether.
And I've had a lot of people tell me, you know, I've had COVID and I've had the vaccine and the vaccine made me feel worse. But the reality is that when you feel bad from the vaccine, it's your immune system. It's helping to protect you. And what it's protecting you from is a complication of COVID-19. It makes the disease milder. It prevents you from having, oxygen requirement, hospitalizations, or complications, again, long COVID. So that I appreciate that it makes some people feel bad, and you have to plan for that. I think overall, the risk-benefit ratio clearly favors vaccination.
Those interested in getting that flu or COVID vaccine, Dr. Lamar says, should talk to their own doctor to make sure that it's a good fit. And he also says that if you can get those vaccines now, like at the end of October. That way it takes a couple weeks for that full efficacy to take place. That way you can be ready to go for the holiday season. Reporting live, Meredith Stutz, WLWT News 5.